Hello everyone, welcome back to my channel. In this session, we will be dealing with the topic perineum. Perineum is again a very favorite question for most of the exams. We have a lot of things to discuss under the topic perineum. So in this session, I will be going superficially and I will try to make you know what do you mean by perineum. So before coming to the topic perineum, we know that this is, if you consider this, first imagine your pelvis. Okay, so if this is pelvis, this is the hip bone, and we have true pelvis and false pelvis. So true pelvis and false pelvis, we discuss it based on the pelvic inlet. So this is called the pelvic inlet. Okay, so above the pelvic inlet we have the false pelvis, and below the pelvic inlet we call it as true pelvis. And we know we have a lot of abdominal organs as well as pelvic organs, and all these are supported below by a diaphragm called the pelvic diaphragm. So this green colored thing is called the pelvic diaphragm. Okay, so we have the pelvis, we have the pelvic inlet. Above the pelvic inlet we have the false pelvis, and below the pelvic inlet we have the true pelvis where we have the pelvic organ seated, and we have the pelvic diaphragm which will be supporting the abdominal, the coils of the intestine as well as the pelvic organs, and we have openings in the pelvic diaphragm through which these organs will make its exit. So what do you mean by perineum? So perineum is that part of the pelvis which is lying below this pelvic diaphragm. Okay, so that region is called the perineum. Before we move on with the perineum, we should know that it is the lowermost part of the trunk. When you consider the trunk, the body, the lowermost part of the trunk is called the perineum. And if you place the person in the lithotomy position, we will ask the patient to lie down with hip and knee flexed. That is called the lithotomy position. We can make it out as a diamond shaped region. Okay, so this is actually a 2D diagram. If you consider it as a 3D diagram, you will have a triangle in the anterior aspect and you will be having a triangle in the posterior aspect, and it is somewhat bent. But in this diagram we are just flattening it out, and this will be the shape of the perineum. Okay, so perineum is below the pelvic diaphragm, that space, that region in the body, the lowermost part of the trunk, and we can divide the perineum as an anterior triangle and posterior triangle, and in lithotomy position we can imagine it as having a bend, and if you straighten it up, this will be like this. So we can discuss the perineum as having two sets of boundaries. One is the superficial set of boundaries which you can make out with the skin and soft tissue, and the deep set of boundaries which we will be discussing with respect to the bones and ligaments. So that is about the superficial and deep set of boundaries. Okay, so when we talk about perineum again, it is different in males and females depending upon the structures related to the perineum. When we discuss the structures in males superficially, in the anterior aspect you have the scrotum, in the posterior aspect you have the buttocks, and on either side you have the uppermost part of the medial aspect of thigh. So that is how we will get when we discuss about the superficial boundaries of the perineum in the lithotomy position. And whereas when you come to a female perineum, anteriorly you have the mons pubis, posteriorly it is one and the same, that is the buttocks, and on either side you have the uppermost part of the medial aspect of thigh. So that is how superficially with respect to the skin and soft tissue the perineum will look like. Coming to the deep boundaries of the perineum, that is nothing but the pelvic outlet. We discussed about the pelvic inlet and outlet. Okay, so the deep boundaries of the perineum will be dealt with respect to the boundaries of the pelvic outlet. So let's see how it is for males and females. The interesting part is when we discuss about the deep boundaries, it is one and the same for males as well as females. Okay, so starting from anteriorly, you have the pubic symphysis. Okay, so anteriorly you have the pubic symphysis, posteriorly you have the tip of coccyx, on either side you have the ischial tuberosities, and when you see the anterolateral aspect which connects the ischial tuberosity with the pubic symphysis, it is the ischiopubic ramus. And posterolaterally, between the ischial tuberosity and the tip of coccyx, you have the sacrotuberous ligament. So this is how we have the boundaries for the perineum, the deeper aspect of the perineum. So it is nothing but the boundaries of the pelvic outlet. Once again, you have the pubic symphysis, you have the tip of coccyx, on either side you have the ischial tuberosities, and you have the ischiopubic ramus anterolaterally, and posterolaterally you have the sacrotuberous ligament. So these relations are same whether you consider the male perineum or female perineum. Now the next thing is, you are going to divide the perineum into two triangles for better explanation and discussing the structures within. So how will you divide the entire perineum into two triangles? That is based on an imaginary plane or imaginary line connecting the two ischial tuberosities. Can you see the red dotted line? This is in female and this is in male. So this red dotted line represents the imaginary line connecting the two ischial tuberosities, and based on this you can divide the entire perineum into an anterior triangle as well as a posterior triangle. So anterior triangle is otherwise called urogenital triangle. Why? Because you have the openings of the urinary system as well as the genital system. Hence it is called the urogenital triangle. And posteriorly, the triangle is called as the anal triangle. Why? Because you have the opening of the anal orifice. Okay, so you have two triangles both in males and females based on the imaginary line connecting the two ischial tuberosities. And in the imaginary line, you can note one important landmark, that is called the perineal body, and this perineal body in females is considered as the gynecological perineum. We will come to the details how a perineal body is formed in later sessions. So this is roughly about the urogenital triangle anteriorly and the anal triangle posteriorly. So if you want to describe the boundaries of the urogenital triangle, it is very simple because we have already discussed about the boundaries of the perineum. So urogenital triangle, anteriorly you have the pubic symphysis, laterally you have the ischiopubic ramus which ends at the ischial tuberosity, and posteriorly you have an imaginary line connecting the two ischial tuberosities. And anal triangle, again you can explain it likewise. You have the ischial tuberosities on either side, you have the sacrotuberous ligament, posteriorly you have the tip of coccyx, and anteriorly you have the imaginary line connecting the two ischial tuberosities. Now the difference is what all structures opens through the anterior triangle or urogenital triangle. That is the only difference which you have in males and females. Posteriorly you have just the anal orifice opening, and that is the same for both males and females. Anteriorly there is a small difference, that is, in case of males you have only the urethral opening in the urogenital triangle, whereas in case of females you have the urethral opening and posterior to that you have the vaginal opening. So that is the difference which you get in the urogenital triangle in case of males as well as females. So I will just try to sum up this very small region. Perineum is the lowermost aspect of the entire trunk. You have the pelvis with a pelvic inlet and a pelvic outlet. Pelvic inlet separates the false pelvis from the true pelvis, and below the pelvic inlet you have the pelvic diaphragm supporting the entire contents of the abdomen as well as the pelvic organs. And below this pelvic diaphragm you have a region where you have the region called the perineum, where it is divided further into pouches. So we will be coming to the pouches after this session. and you have the perineum divided into anterior urogenital triangle and posterior anal triangle. Now what I would like to say is the perineum is actually having a membrane, the lowermost part of the perineum. Before we discuss about the superficial and perineal pouch, you need to know about a fascia, a triangular fascia in the urogenital triangle, which is called as the perineal membrane. So, you have to know that the perineal membrane is confined to the anterior urogenital triangle. It is not there in the posterior anal triangle. Okay, so perineal membrane is a triangular membrane or a thickened fascia which is seen in the anterior urogenital triangle, and it extends between the perineal body, which is lying in the imaginary line connecting the two ischial tuberosities, and it is attached to the sides, and anteriorly it is thickened to form the transverse perineal ligament. So, transverse perineal ligament is the anterior thickening of the perineal membrane. And there is a space between the arcuate pubic ligament in the pubic symphysis and this transverse perineal ligament, and it is through this gap, the gap between these two ligaments, you have the passage of the deep dorsal veins of penis. So, the structures piercing the perineal membrane, I will be doing it in another session. I just wanted to convey the message that perineal membrane is confined to the anterior urogenital triangle and it is a triangular membrane. Next thing is, so I have mentioned that there are two pouches in the perineal region, that is the superficial perineal pouch and the deep perineal pouch. So, which is the structure which is separating these two pouches? There comes the importance of this perineal membrane. Okay, so perineal membrane, so I have drawn a sagittal section here. You can see, so this is a male with penis and scrotal sac. This line is actually the perineal membrane. Okay, so hope you can make out this line. This is the perineal membrane. So based on this perineal membrane, you have a pouch above it and you have a pouch below it. So above it, you call it as deep. So if you imagine a person standing, above the pouch means it is far away from the skin. So that is called deep perineal pouch, and below this perineal membrane, you call it as superficial perineal pouch. So that is how you get the deep and superficial perineal pouch. Again, I would like to stress one point. Deep and superficial perineal pouch belongs to the urogenital region, urogenital triangle. It's not extending to the anal triangle. All these things, the perineal membrane, the superficial perineal pouch, the deep perineal pouch, all are confined to the anterior urogenital triangle. The next thing which I would like to mention is, so this is the perineal membrane. I have just drawn it's a schematic diagram. If this is the perineal membrane, above the perineal membrane, you have two important muscles. One is sphincter urethrae and the other one is deep transverse perineum muscles. Okay, so deep transverse perineum muscles will be arranged transversely behind in connection with the perineal body. It will be inserted into the perineal body, and the sphincter urethrae will be coming like this from the lateral wall, and it will be encircling the urethral portion. Okay, and that is actually acting as the external sphincter. So that these are the two muscles which you get above this perineal membrane. Sphincter urethrae and deep transverse perineum muscles. So coming back again to this diagram. So this perineal membrane at the posterior most aspect, at this region nearer to the perineal body, this margin is the posterior most aspect of the perineal membrane. It splits into two. Okay, one will go up. It will go up and will enclose these two muscles, the sphincter urethrae and deep transverse perineum, and the other one which splits down, it will be in continuation with the Colles fascia, and anteriorly it will be blending with the abdominal layers. Okay, so that is what is happening for the perineal membrane. At the posterior aspect in this region, it will split, one will go up and the other one will go down. So the one which goes up will be wrapping these two muscles. Okay, wrapping these two muscles, the sphincter urethrae and deep transverse perineum, and that will form a triangular closed space wrapping these two muscles. That is how you get the deep perineal pouch. Okay, so deep perineal pouch is formed when this perineal membrane goes up and wraps the two main muscles, sphincter urethrae and deep transverse perineum. There is another name given to these two muscles, that is called the urogenital diaphragm. Okay, this is called the urogenital diaphragm. The sphincter urethrae and deep transverse perineum lying in the urogenital triangle below the pelvic diaphragm is called urogenital diaphragm. Again, urogenital diaphragm is also confined to the urogenital triangle. And it is wrapped like a burger, or if you just imagine two slices of bread which is wrapped by a butter paper and it is closed. That is what is meant by deep perineal pouch. So urogenital diaphragm formed by sphincter urethra and deep transverse perineum, when it is wrapped by the layers of the perineal membrane, that is called deep perineal pouch, and it is a triangular closed space. Okay, so we can name the membrane covering the urogenital diaphragm as superior fascia of the urogenital diaphragm, and the one which is lying below the urogenital diaphragm as the inferior fascia of the urogenital diaphragm. Superior fascia and inferior fascia, and this inferior fascia is nothing but the perineal membrane. Hope this idea is clear. The perineal membrane is actually the inferior fascia of the urogenital diaphragm. So once again, we have the perineal membrane, we have a region above the perineal membrane, and we have a region below the perineal membrane. Above you call it as deep perineal pouch, and below you call it as superficial perineal pouch. Above the perineal membrane you have the urogenital diaphragm, a triangular diaphragm which is made up of two muscles, sphincter urethrae and deep transverse perineum. So the perineal membrane at the posterior aspect, it splits into two. There are many theories about it. The simplest of the theories is like this. So it splits into two. One goes above the urogenital diaphragm and the other one below, and it blends in case of males with the Colles fascia and the anterior abdominal wall. The one which is going above wraps the urogenital diaphragm and forms a triangular closed space, that is called the deep perineal pouch, and the one which is lying below the perineal membrane is called the superficial perineal pouch. And this perineal membrane is actually renamed as the inferior fascia of the urogenital diaphragm, since it is lying below the urogenital diaphragm. That's the only difference for the naming of the perineal membrane. So I would like to sum up what we have dealt right now. We discussed about what do you mean by perineum. That is nothing but the region below the pelvic diaphragm with the soft tissues and spaces, we discussed about the boundaries, the soft tissue boundaries which we consider as superficial boundaries, and the deep boundaries, it is nothing but the pelvic outlet boundaries. Then you have the urogenital triangle anteriorly and the anal triangle posteriorly. In case of males and females, the urogenital triangle, the structures piercing differ because in females there is an extra vaginal opening. Then coming to the perineal membrane is confined to the anterior urogenital triangle, and the urogenital diaphragm also is confined to the anterior urogenital triangle. And there is a fascia wrapping the urogenital triangle, superior fascia and the inferior fascia. So this inferior fascia is otherwise known as the perineal membrane, which we discussed right now. And the closed space above this perineal membrane is the deep perineal pouch, and the space which is lying below is the superficial perineal pouch. So please let me know whether it is useful for you, and also I would like to know whether I need to continue with the superficial and deep perineal pouches or the ischiorectal fossa, which belongs to the anal triangle. Ischiorectal fossa is always asked as an essay or short note, short essay or short note. So please let me know. According to that, I will be doing the next session. Thank you. Thanks for watching.